Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist, and in this video we're going to talk about the 5 dry eye treatments you can do at home and without a prescription, all natural, safe, and effective. Before I get started, please like and subscribe to my channel where I post a new video every Saturday about eye health and disease. The first dry eye treatment that you can do at home is to apply a warm compress to your eyelids. There are certain conditions like ocular rosacea where you may want to use this treatment sparingly, but for most cases of dry eye, this could be very helpful. Warm compresses help with blocked meibomian or oil glands that we all have on our upper and lower eyelids. The lack of oil in our tear film causes quick evaporation of our tears that can lead to a type of dry eye where you make tears but not good quality tears that don't really do a good job lubricating your eyes. My first tip for this is to use warm, not hot compresses. Check the temperature with the back of your wrist or elbow to make sure you don't burn your eyelids. You want to make sure that you have at least 5 minutes of heat to your eyelids per session, and I would recommend you do this 1 to 2 times a day for best results. There are a few ways you can make a warm compress. You can use a clean washcloth and run warm water from your sink, bath, or shower and apply the washcloth directly on your eyelids for wetting with warm water when needed. A more elegant way to do a warm compress is to buy a special eye mask. I recommend the Dr. Booter mask, and I've linked this down below. A poor man's version of this mask is to use a clean tube sock, fill it with rice, and tie the end with a string. You can microwave the mask or the sock contraption for 20 to 30 seconds and apply it to your eyelids, with or without a thin towel in between the warm mask and your eyelids. This contraption will retain heat longer than a wet washcloth. The next dry eye treatment is to work on creating an environment that is helping, not hurting your eyes. I live and practice in Arizona, which is one of the driest states in the United States, and almost every patient I see here has some degree of dry eye just from living in such a dry climate. I frequently recommend getting a humidifier at home or at work to moisten the environment and help decrease evaporation of tears from the eye. Another important tip is minimizing air conditioners, heaters, and fans blowing directly into the eyes, since these will really dry out your tears and worsen your dry eye symptoms. You should also consider changing your diet to help with your dry eye symptoms. The easiest thing you can do is drink more water and stay hydrated. Also, while controversial at the moment, I don't think it would hurt to eat foods with more omega-3 fatty acids and flaxseed oil, since there is some evidence that this change can make a difference for some cases of dry eye. Another important treatment is giving your eyes a chance to rest. Not only should you be getting a good night's sleep, when we are reading or on the computer or phone, we are staring a lot and our blink rate goes down. This can cause tears to evaporate from your eyes and can really dry out your eyes and blur your vision. The easiest thing you can do is to close your eyes for a few seconds when your eyes start to feel tired or dry. This gives your tears a chance to lubricate your corneas and your eyes get a chance to rest. The most important dry eye treatment I have is to lubricate your eyes with over-the-counter, preservative-free tears and ointments. This is going to be the first treatment your eye doctor will suggest for any dry eye symptom, and preservative-free artificial tears are extremely safe and effective for pretty much all types of dry eye. Also, if you wake up in the morning with eye pain or irritation, or you sleep with your eyes partially open, you might be drying out your eyes at night. I would recommend an ointment or gel. You can put a small amount, about the size of a grain of uncooked rice, in this inner pocket between your eye and lower eyelid right before you go to sleep. This will make your vision blurry and your eyes sticky when you blink, so this is best done right before you go to sleep or take a nap. If all of these at-home tips and tricks fail, it is time to see your eye care provider, since we do have a lot of great treatments available to help with your unique case of dry eye. Do you have dry eye, and has there been a treatment or lifestyle change that has worked well for you? Let me know in the comments below. Thanks for watching my video. Remember to like and subscribe, and I'll see you in my next video. Bye!